Sorry. Give me just a second here. Let me see if I can get this filled out. Did you have questions? You were saying that you were having issues with diagnosis codes from sticking?
Yeah, to adding into the certification and on the OASIS.
Okay, so let me fill this out as fast as I can.
And did Molly also get with you yesterday? Because we were wondering, again, which browser you were using, because I've noticed myself personally, for some reason, I have problems in Opera as opposed to like using Chrome or Firefox. Did she talk to you about, I mean, I wasn't sure what browser you were using.
I'm using Chrome.
You are using Chrome, okay.
Okay, we'll see if we can troubleshoot that here in just a second. I have another OASIS somewhere, but we have so many test patients, I'm not sure where it's at. And this one will be available, so we can always refer back to it again for any coding issues. And remember, the clinicians will have to use some kind of a generic code because they'll have to have at least a primary diagnosis in their integrated assessment.
Yeah, and could our intake use that generic code as well? That's what our current process is.
But it won't go on.
Well, if they put it on the referral, it doesn't flow anywhere. It doesn't go anywhere. So they can't really enter it. It has to be entered in the service note. Now, that's only really on the starter cares. Moving forward, it's going to carry over all the previous diagnosis codes. So all on your research and rocks, it'll pull them over automatically, and then you can make changes to them as needed.
Okay.
So that means the rat that gets dropped would be from the OASIS, what we put in there. It could be wrong. That's where it's going to come from. It's not coming from intake.
Yes, I was able to code my own here, so yeah, when I was practicing, it's still there, so.
Yeah, all the clinicians are going to have to put in a code, otherwise they can't get it completed.
Too. I tried the intake code and it wouldn't. It first asked me for a date, but I ignored it because that was the date for code G, the 7th. So I ignored it. And then when I went back, it kept asking me for a date for that code.
And you can't, and there's no spot to put the date.
There's no spot anymore to put the date.
Oh.
And but I mean, it
So
did.
you maybe just put a real code and it gave,
I did.
They're all real codes, but picked a code that was acceptable for home health coding.
Yes.
Then it gave you the box and then you got the exacerbation.
Immediately.
So when we use suture removal, it doesn't give you a box for the date.
Oh.
And it doesn't give you to put in an exacerbation, but then when you try and complete it, it gives you a red mark saying you must enter a date, but there's no calendar to put the date next to it.
Yeah.
So then I went to the 45 because I had already admitted and went to the 45 and I tried to put in my Z48.02. It didn't go, wouldn't find it. I had to literally go in and type in suture, search, select, and I'm like, okay, this is, I know it's
Maybe
about.
there's another code we have to use then.
Yeah, but even like I tried to put in congestive heart failure and typed out congestive, nothing comes up. You'd have to go to heart plus.
Oh, I see. Yeah, I just put the number in because I knew the number.
But
so.
even when I knew the number, if you try to change it, see what happens. Put
Okay.
Z48 or 2. It's a valid PDGF
Let me
code.
go back in.
Is Brendan just trying to answer a whole Oasis so we can get to the approved status?
Yeah, are you answering
Yeah,
that? Okay.
yeah, I apologize. I wish I had this ready, and then there's another one in here somewhere, but it's lost. I've got too many test patients at this point. I'm almost done, though. Just one more second here. Oops, that one is required. All right, so now that we got one done, no, you guys will need to know or communicate, that probably have that, whoever's doing those notes, notify the coders or the team that, hey, I'm done with my note, so that you guys can go ahead and get that coding done as soon as possible, get those 485s, approved. But what you need to do when you need to update codes, let me make sure that this one doesn't have any, it's not sent, okay. The 485 does need to be in a initiated or saved status.
How do you
And then
recommend
you'll come
they
over
send
here
that?
to unread
To the-
messages.
Okay.
I'd have them send it directly to the coder or the whole team. If you guys have whoever they need to notify to let them know, hey, I'm done with this. You guys can start doing your part. Because again, you got to do the QA. You need to look at the Oasis, make sure everything's good. You make sure the 485 is good. And of course, you may have other disciplines that aren't completed with the 485. But for the coding portion of it, once you're notified that is approved and you're ready to code, you'll, of course, review all the documentation from the Documents tab, Clinical tab, the documentation that the clinician did, any referral information that may be helpful, however, how you guys code today. You gather all your information from everywhere in this encounter. Then the next thing you do, and, of course, your information that came over from the referrals, doctor visit notes, all that kind of stuff, it's all going to be on your Documents tab. When you know what your codes are going to be, you're going to hover over the little action item menu next to that approved service note, the Oasis Integrated Assessment. You're going to see this link that says Update Diagnosis Codes. You'll click on that. The one code that they put in there will be there. If that is incorrect, of course, you just go ahead and type in the new code. Now, if you know the ICD-10 code and you type it in here, you still have to hit the drop-down box and pick it from this list, okay? And then you can have that in there. And again, you can just type in part or all of the description and hit the drop-down box, and it will give you any of the diagnosis codes that have that word in there. And remember, if you're doing the description, be careful if you don't enter it like this one, essential hemorrhagic thrombocythemia. If you don't put the hemorrhagic in parentheses, it won't show up as an option in this list. But you have to pick them from this list or it will not take. This number box, this box over here to the left is your sequence. So you'll have your number 1, number 2, number 3, number 4, and so on. If you want to change your sequence, you need to address that one and then come in here and address that one as well. They cannot be the same sequence number. So you do have to make those changes. You do have to do your symptom control rating for those diagnoses and then the onset or exacerbation date. And then when you get everything the way you want it, you can,
The clinician doesn't add the symptom control ratings?
if they add the diagnosis in the OASIS integrated assessment, absolutely. It will actually require the symptom control rating and it will require the onset or exacerbation date. If they do not enter it in their OASIS integrated assessment and you guys need to add it on the back end, then you would have to do this.
Okay.
And you may need to reach back and get back in touch with that clinician to ask them, the control rating for those codes. But it will be required if you add new codes in here. So every time you get one, it's going to open up the symptom control rating. So you're going to have to add that, and you're going to have to add the date, and your sequence.
Now, if you add a Z code,
have
you add a Z code to make sure it won't populate the symptom control?
7-1.
Just do Z4802, Z48.02.
Yeah, it'll be there. Now, I don't think you can use Z codes as a primary.
Yes, you can. That actually is one that you can.
All right. Yeah, it'll take Z codes. We update the, ICD. We update every version of ICD they come out with as soon as they come out with it. And then, of course, if they make changes, like last year, October 1st, they had all the new codes. They're going to be available at that time. Now, sometimes if you enter a date here that's outside of an active date for the diagnosis code, then it will not show up for you. So you may need to research, what code, when what it changed to, or what the effective date of that code may have been, and then code appropriately based off that. But then once you're happy with them, you'll hit save. Sequences must be unique, and I did not make them unique. If you have any errors, it'll give you those errors. Now, that'll update the diagnosis codes in the service notes. So the print view will show those updated codes. So when you print off your service note for any kind of an audit, it will match. I'll just kind of show you real quick. So here's all my new codes that I entered in here. And apparently I didn't enter a symptom control for that Z, or didn't ask for it. But there's the updated codes will be available in the print view. The top 6 diagnosis codes will be updated in the start of care. So if you were to go back into this OASIS, it's going to have the specific codes. Of course, this one is only going to have the top 6, but you'll see those codes here. Now, on that other screen, you can enter as many cert diagnosis codes as you want. The top 6 will flow here. All the other ones will flow to the that service note, as well as in the 485, you'll see those codes will be updated here. So it's done automatically everywhere all at one time. That's the best way to do it. You could manually come to the 485 and add those codes in here, but then you'd have to go to make sure that OASIS, those top 6 match there. If those codes do not match, these top 6 in here, and the OASIS did not match, you would not be able to lock your OASIS. It'll give you an error saying that they have to match. So you'll either have to come back to the 485, make those changes, and then go back to the OASIS and lock it, or figure out what the discrepancy is. But if you do it the way I just first showed you, from outside of the service note, then it's always going to be correct. It's going to be correct everywhere it needs to be correct. So that's the way to do it. And then after coding is done, again, you see that it's updated them everywhere, so you're done with that. And then you would need to let the appropriate people know that that has been done, coding is done, so that they can, approve the 485, lock the OASIS, and then you're done with this whole start of care or recert or whatever.
So what happens if there is a time where you are doing the code change on a 30-day where there's not a OASIS assessment attached?
Then you need a clinical update order. That's the only way to change diagnosis codes without a 485.
Correct.
Is the clinical update.
A clinical update order, so that I'm just going to go ahead and add the diagnoses on there, and it won't be looking for an OASIS assessment as long as that's done, correct?
Correct.
Okay.
So you can do those directly in here. And of course, that's extremely important. Get those in there because it's going to affect your payment. So get these added as quickly as possible as soon as you find out they have a new one. So if there was a resumption of care and there was no diagnosis change, then they would not need a clinical update unless their activities permitted, their diet changes, their allergies change, any of the top part of any of the 485 that changes from the 485, besides your frequencies and durations, then you'd also add one of these, whether the codes change or not. And those will pull from the, watch if I delete this. Can't delete it.
So where do we put the date so we know what clinical update this, is it how do we, for the clinical update, how do we know where to pull that date from? Or where do we place a date to say it's as of the 10th is the update?
What do you mean the effective date of the order? Is that what you're talking about?
The effective date of the order. Is it when it's created?
Yes, exactly. I'll show you real quick because I need to do this one too anyway.
And Brendan,
Yes.
this could probably answer another question that I have. This might be the answer. So you do your resumption of care and you realize that you need different care needs. So you then choose the care needs for this rock. Those will go on the clinical update order to get signed by the doctor?
Yes.
Okay. And then would that be true? Go ahead.
Yeah, you'll end up adding a clinical update. You'll get, let me just get through all these. See, activities permitted, required mental status, are required. So again, a lot of your orders are going to need to be in an approved status to get the option for this. So that's what I'm going through here real fast.
So with that, as you're typing, the additional question I had was, for example, we have a total knee patient that comes on. We anticipate them starting outpatient the 4th week. So we do our start, we put in a frequency of 2 week 3. That's what goes on the 45 with the care needs, everything's good. And then we're getting close to our anticipated discharge and the patient's not ready. So we need to add a 2 week 2. But we also we need to use an addendum order, I'm assuming, to get visits that will give us a frequency. But let's say we need to add more care needs, because on the 45 that went out, well, one, they would be end dated for what we put. So now we need to add this 2 week 2 and we need to add care needs. How do those care needs go out for signature?
On a clinical update. A clinical update is the only other order that you can add care needs to or attach care needs to besides your 485. So you're going to choose to add an interim order. You'll choose a clinical update, and the effective date of that order is what's going to be important there. And then hit save, and you'll see the effective date will be from 4/14.
And
so
Brendan,
you can make any changes. Uh-huh.
Does that give you a frequency too, or do you have to do an addendum or
No.
any clinical update?
Both. You'd have to do an addendum for additional frequencies and durations, and you'd have to do a clinical update for any of those other changes. Like, again, for your care needs, you have to do a clinical update, even if nothing else changed. And so when
Okay.
you get your clinical update in there, you'll come outside of it. You'll just do save and close, and then you're going to do attached care needs, just like you did with your 485 with the attached care needs here. You're going to do the exact same thing. Choose the effective date for that care need, your discipline, and then you would add all that information. Now, let me show you just an example here. I don't know if we have other stuff in there. We'll just choose this one. So this is the new care need. So I'm going to come in here, and you'll see that now there's my new care need. And again, you're going to add the information just like you did your other ones. You'll add your interventions, add your goals. Then you'll edit the intervention descriptions and your goal descriptions if needed. And that's going to take care of that one. Now, if anything else does not apply anymore, while this is in an open status, while your clinical update is open, you're going to have these edit pencils next to all of these. And then you can come over here and for all the additional ones, you can either edit goals, and now you can end date them. You can show that they're met or document anything else, and you're going to want to address everything if everything that changed. So anything that is no longer applies, you want to address those, and then your new ones, you'll want to add those. And it may be a new intervention for an existing care need. Maybe they just added a different intervention that is attached to impaired mobility. At that point, you can come in here and still add interventions and choose what's still available and get that added as well. And then when you approve your clinical update, then all of this will get locked down, and when you print and fax to physician or print an update sent, then that, I'm on the list, then, of course, everything's going to be locked down, and that clinical update will have that information on there. But yes, for additional frequencies and durations, you'll have to add an additional order for your calendar.
So the doctor
and
will
that's
get
going to happen on your resumptions. Huh?
So the doctor's going to get 2 documents to sign. So let's not use the rock scenario. Just, I thought it was going to be 2-week 3. I need to add a 2-week 2. I'm assuming that the care needs that went, let's say you didn't really need to change care needs. I'm still thinking we have to, because the care needs that went out for signature had a frequency of 2-week 3. So those care needs, I'm in my mind thinking that's what the doctor's signing off on, those care needs for 2-week 3. Now I need to do a 2-week 2. Yes, I can just get a frequency, but if you add additional visits, I would think you have to add care needs, right? Would they even show up in the visits? Like when they go to do their revisit, would it?
Yes.
Okay.
If those care needs were never end dated.
End dated? Okay. The clinician will get them.
If they were
but
never
is it
end dated, they're going to cut. They'll keep flowing until they are end dated.
Okay.
So no matter what, they're going to keep showing up in that note. So yeah, if you want, if that's a compliance thing that it's kind of on you guys. If you have been told that you guys have to have a whole nother, because your 485 is going to have the interventions and goals, and if you don't have an end date on them, then they are going to just keep flowing and flowing and flowing. If you guys as an agency think that you need to have another clinical update that shows those date ranges, then that is absolutely, you have the only other order you can add them to is a clinical update. And if you have frequencies and durations changes, you'll either need to do an addendum order just to add those additional frequencies and durations, or replace discipline, or any of those other ones that have a calendar that might affect that. That's the only way you can add those visits.
Thank you. Go ahead, Keynote.
Okay, Brendan, I had a question. Did I hear you correctly when you said if we are doing a resumption of care and there is no care need changes and no coding changes, that we may not need a clinical update?
Correct. If nothing changed, other than your frequencies and durations, because that ROC order is going to allow you to, when you reactivate the patient, you're going to wipe out all those visits, from that effective date. And then you're going to add your resumption of care order, and it's going to ask you what discipline and the effective date. And we demonstrated that previously on this patient, but it's going to plot that discipline, an assessment service for that discipline on the effective date of the resumption order, and then it needs to be assigned. And then that 1 week one will be in here. If you had additional disciplines that also need to assess the patient, such as PT and OT and SD, if this order was in an open status, you'd have the option to attach assessment service from outside the order. And now, again, assessment services are the ones that allow you to assign it to a clinician. They can have scheduling notes, service notes. It can be verified, and it does not lock down your frequencies and durations inside your resumption of care order or your 485. And those are the only 2 orders you can do the assessment services on. Then when the clinician goes out, they'll do their, Rock Oasis integrated assessment, finish all that stuff. They'll come back to the resumption order and add their frequencies and durations to that, as well as all the other disciplines. They'll come directly back into that resumption order. In the verbiage box, the order description box, they'll write, resume all previous interventions and goals, things like that. And then again, whatever the frequencies and durations is from that assessment moving forward will print automatically in front of that discipline or behind that discipline on the order, so that you'll have that updated information on here. And then if there was no changes to your care needs, then you're done. If there is changes to your care needs, then you have to add an additional order for your clinical update order so you can address those.
Okay. And how
Mhm.
how would care efficient, if this resumption of care was done in the last 10 days of the last 30 day without a recert, like in between, how would it calculate that it's going to be, let's say, a late institution versus a late community?
Well, that's the earlier late is going to be in there in the OASIS as a question. Their source admission type are what's going to determine the community-based admission versus institutional, whether they were transferred from a hospital. This is what's going to determine that information.
On a
when
rock.
You're activating the patient.
Back again. So they're going to get the same. So this screen is the start of care, but on a rock, are they going to get a screen similar to this?
Let me see if I can add one and show you. It's your normal resumption OASIS. Let me show you. So you'll have the resumption of care date here. Of course, all this other information will be the same as normal. The date of the assessment was completed, the date of the physician order start of care resumption, and then here's your M0110 for your earlier late.
Yes, but then we need to capture the community, the institution. Does that base off of 1005?
Yeah, that pulls from the profile tab. Let me see, where's the 1005? It's not in the resumption.
Yeah.
This is the only thing.
It's below. You're passing it. It's above. It's right. I'm just wondering how does care efficient calculate that? I mean, it's not going to be put in. I just want to make sure intake doesn't have to put something in for you to calculate that. Does it calculate solely off the OASIS, that inpatient discharge date? Is your billing going to know on that second 30 day, based off of that OASIS question, that it's going to calculate a late institution if they mark it correctly?
Yeah, that's done automatically. You'll answer the OASIS appropriately, and then the billing is done as far as that part goes. JP, you can jump in if you're still here. There's nothing else you need to do for that. That second 30-day wrap will still generate. And again, the clinical update, if there's diagnosis codes, that you have to have that in there because that's what's going to affect that wrap as well. But other than that, it's just your Rock Oasis here that you're going to your answer to all the questions. Now, do you know what as far as the institutional, JP?
Well, I guess I'm trying to understand. Is your question because with the rock, are you saying that your second 30 day you're changing your score so that you're going to have a higher reimbursement in the second 30 days because of the latest admission?
Correct. The late institution. A late institution is typically higher than a late community. So I just want to make sure where should we really look to double check that it's there. Currently, we have like a inpatient event that's supposed to be entered, and a lot of times it's missed. I just want to make sure, because I go back and I double check everything.
Well, Brendan, on the rock, isn't there a place for it has the facility, so it knows that it's coming from there. And then again, if they do have a higher score, I know that it'll update the but I'm just not sure. I mean, because I'm not a clinician, I don't know where on that rock that you tell them that the rock in itself would tell you because you're resuming care. You have to have the facility that they're coming from a facility.
Correct. So that's
what their discharge date was. And that's what's going to trigger that. And if it's a higher calculation, you'll see that under that PDGM analysis for that second 30 days, you're going to see a higher PDGM, and that'll transmit to the bill.
Okay. All right.
Yeah.
So that's where we'll look to see what it's coded. We'll go to the PGGM analysis and make sure that the sequencing is for, what is that, 3 late?
Yes.
Yeah, so we'll have to make sure in the 4 letters that it's a 3.
And it's based off of that,
Right.
Just so we know how to get. Okay. Thank you.
Mm-hmm.
So, Tina, did you get your coding questions answered? Because
So when I was having problems, I was trying to do it as if I was a clinician in the assessment. So I just want to make sure if a clinician goes into their assessment and they're adding a code, I initially did not put in a date because the date that it asked me to put in was on line G. And I just ignored it because I knew I didn't put in a code on line G. But when I went back and tried to add in the code, the date did not populate again. It didn't ask me to put it. So I wasn't sure if it was just my user error or if you miss putting in a date initially, you don't get it back.
and if I could piggyback onto that question, so our process, and maybe you guys have a better suggestion, the plan is to tell all starter care clinicians, all of them are going to use the same code. That they're not going to try and guess anything or figure anything out. We're just going to tell them they have a piece of paper that says whatever the code is. The code that we normally used was that suture removal, and then billing knew not to drop a wrap if that was a code that was in there because they knew it was incorrect. Mm-hmm. Obviously, our process is changing. This is going to have to be verified, and it really doesn't matter if it's wrong or right, the code. But when you try to go in and complete, it gave us an error saying you needed a date. But when you go back to try and put in the date, there's no calendar for that suture code. So do you guys just recommend a certain code that you tell everyone to put in, or that's the question, isn't it, Tina?
Yeah.
Yeah, we don't tell them what code, but that's what the majority of our clients do is that they just pick a code and everybody, just like you're saying, and so if you see that code, it doesn't go out on your bill. That's okay. I mean, it's whatever one you want to put on there. I mean, because you're going to have somebody else do the coding. The date thing is what I'm kind of watching, and looks like Brendan's working on that. I don't know if we have a problem with that.
Yeah, see, so when we put in that code, all of us, we couldn't get the calendar for that code.
And that was
right, I know, that's what I'm saying. I think it looks like, I don't know if we have a problem with that because I haven't heard anything about that. And I know other clients we don't tell them a specific code, they just pick a code and everybody uses that.
Okay.
So, yeah, I don't know if he's.
And you were saying that was inside the service note?
Yes, so as we practice as clinicians, we put in, go ahead.
You can't go into somebody's.
You're fine. I'm going to just unapprove these so I can follow along.
I want to do it.
I10 hypertension?
Mhm.
Yeah.
That's the one I always use just because.
Yeah.
Which we'll use that
just-
one, that's fine if that works. I just need it to work.
I can't get
So
in.
Z48.2. Let me just get rid of all these.
Well, we tried it, we did test it on a patient that had already originally put dates in, but, and the patient, and it wasn't an issue, but on the patient that I tried it on, it was not there was never a code in there.
But you were saying that if you forget to put the date in, it doesn't give you the opportunity, and then you can't get back to remove. I'm not sure I understood. That's what I was trying to figure out.
Yeah, so I did not initially put a date in, and I went to the next screen. And when I went to go validate, it gave me an error, and I went back to the screen, searched for the date because it told me it was an invalid code, an invalid date, put in a code, but then could not get a date back.
Ah.
See, and mine, JP, was when I used the suture removal code, so it was first time out, put in the suture removal code, the calendar never populated. It never gave me an option for the calendar to enter a date. Got to the very end, tried to approve it, and then it said I had to put a date in. It happened to Tree too. We both went back to the assessment, but there was no spot for us to put the date. Because the calendar.
So Brendan, let's
never stopped.
Let's try with that specific suture code. Let's try and recreate their exact problem with that suture code.
But I think Keena's point is. Yeah, because this one,
it
a
gave me-
calendar came up.
Oh, you do have it up there. I'm sorry, I didn't see. I'm
Right.
looking on too many screens. I gotcha. So it did. So that's what. So if you didn't put it,
I mean,
it says date required, and then it's there.
But this assessment, he originally had codes
Right.
and deleted them. It's a new assessment. So if we could delete maybe this assessment and add a new one, and then just.
Sure, let's try that.
Okay, as Brendan's doing that, I think Molly sent you guys a click. I created in the settings under lookup tables, clinical, and put in care needs, goals, and interventions. Some of them, the goals, when you go to edit goal description, we can edit them and it stays and it sticks, and other ones we can't. And we can't figure out, did we do something wrong in entering them? But we did all the same, and some work and some don't. I know it's a completely different problem. You don't have to solve it right now, but I'm hesitating to go forward and continuing to create our care needs until I know that I actually can do it correctly.
I have one they could play with. I just opened one that I created.
Okay. I gotta tell Leanne.
See, these are pulling from my 485, so.
You should put something in there, the severity.
Oh, I did on this one.
There will be.
Okay, but now I did it. But see, I didn't do it. Okay.
Could you please let Leanne?
Yeah, the Z code won't have a symptom control rating on it, so. But it should have a calendar. You should be able to.
We did go,
I mean,
but
it's
I
going to
didn't put
require it.
I didn't put a date. I think that's what was my.
Oh, right. Z's don't have, right, you're not supposed to do severities for Z's.
Okay, so my calendar I did not put a date.
But I do have the calendar on this. Brendan, we're looking at the patient this is Leslie, I created for a fake patient that I created for my PTAs to play
Oh, I
with.
see what you mean. Yeah, it doesn't see the calendar.
Oh, you did it.
Well, I put in Z79.2. Which one do you want me to put in Z?
Yeah, that's fine. That's fine.
Yeah, when I chose it, there's no
But I-
date.
Okay, that's weird because we're recreating it and Rosa ran into the same problem, but I did it on my computer and on Leslie's and it gave me a
I got it.
calendar. But Rosa's didn't give her a calendar.
Yeah.
So it's inconsistent.
So then complete the rest of the bottom, go to the next screen.
So say, just go next.
Just go next. And then, okay, now try to save and close or approve, try to approve and it'll give you the error.
How did I do this?
See, it says diagnosis needs a date.
Oh, here, yeah, so take me back here.
So now go back and see if it gives you the date selection.
I guess
Go down.
I need to wait.
No.
No. That's some kind of a glitch.
Okay, so
They could go into that patient, you could tell, is it princess or
Okay.
queen or area?
It's Areola Queen.
can you go into Areola Queen because we've just recreated it in that patient?
Yeah, hold on. Let me get to that. Do it. I'm gonna try to do it right here. This is a brand new patient. So you did Z 48.02. Oops. And then you hit the drop down box, correct?
I think we
Chose
might
the
maybe.
code.
Oh, maybe we just did tab or something.
I bet you we're just entering the code.
Oh, see, there's no date. So press enter.
Well, there's not a date for that Z code here either. And see,
Okay,
that's
so
why I was,
Is it because that's a procedure?
No, because but then it asks you.
Right, at the end, you won't be able to get it approved because you have to put a date in.
But is it because it's a procedure and it's not a diagnosis? There's no, I don't know.
Well, I mean,
I think
it's
that
a procedure. It's a valid PDGM code.
But it's.
It's not a procedure.
It's attention to sutures. It's an ICD-10 code.
Okay.
I'm just,
that's
I'm just
correct.
hypothesizing.
But
Yeah,
I
no.
think I remember, I've talked to Todd, I talked to development about this before. You're not supposed to use Z codes. I think is what he said. You can't use Z codes for a primary. You can
Yeah,
use it as any additional codes.
No, that's not true because
Total joint.
total joints start with the Z48.1
47.
and aftercare.
Yeah, but there were
codes-
some Z codes that they said you couldn't use as a primary one, and I wonder if that's what the issue is, because
No.
the primary sutural code is one of the ones. But you would think it would say it's not allowed. There are some Z codes that are not allowed as a primary diagnosis code.
Correct, and that is a PDGM reimbursement. If I wanted to, I could bill it, and it is a valid code in PDGM as well.
But not as a primary, I would think.
No, it is a primary.
There
It's
has
a primary.
because you're removing sutures because there has to be another diagnosis. That's what I'm thinking. That's what the problem is. The suture removal is subsequent to what the actual problem is. What are you removing the sutures from? That's your primary diagnosis.
No,
It's
Z47.1, it's the same.
do,
That's
just try Z47.1 now. Try Z47.1.
Yeah, that's valid. Do that as a primary. Oh, there it is.
Okay, does it give you?
That's it.
There's no
It's the
date.
Dates.
But see, again, I think because it's the code, because again, aftercare following joint replacement is your primary that Z code cannot be a primary diagnosis code.
Yes, it
That
can.
cannot be your primary diagnosis.
Yes,
That's a follow-up
it is.
diagnosis.
No, it's not. It's a primary diagnosis.
I'm
two
pretty sure it's not. I mean,
certified
I'm not a coder, but I'm pretty sure that the actual one would be the joint replacement. The aftercare is not your primary diagnosis.
No,
So in home health coding, so this would be what therapists do. They can't code the original thing that you're suggesting. This is our primary reason. We are providing care, aftercare following the joint replacement. And it is acceptable and it is coding conventions and there's 2 certified coders in the room. So if we have to do a
I mean,
workaround,
CMS came out with a list of codes that were not acceptable.
okay, I10. I10 is an acceptable code.
Yeah. It's there may be an issue because now I'm not getting the
Yeah,
date on this.
now that one you're right. That is I've seen that one.
Okay, so now if you try, once you get this glitch, no code gives you a date, is what I found. Because after I tried to do any code and once you lose that date box.
Once
there
you
is
lose
no-
the date, it doesn't come back. So, Brendan, let's delete this now and go do another new note and put a correct diagnosis in there first and
It's
see.
all
But I
correct.
think it's what it is. It's something to do. And I know that Todd has codings around the Z codes, and I bet you any money that's where it is.
Okay, well then I need to talk to Todd because there are lots of Z
Well, that's not an
codes
option.
Our
Our developers don't talk directly to clients.
Okay, well then, those Z codes we can show you many claims, the CMS approved PDGM codes, primary diagnosis, and there's lots of Z codes that are. So,
Yeah, it would be also like the Foley healthcare. We start
yeah,
off.
the full attention to Foley, you know.
0.6, yeah.
So that, I mean, I'm sure there's probably an issue with something maybe that it happens, so we just need to know what it is. But
Well, it's good to be finding it out now
Yeah.
rather than later. And I'm sure it's an easy fix.
yeah, we'll just have to
but we
figure out
just
what
need to, yeah, figure it out.
right now, because I don't
So
want to.
if you put in, and again, I mean, Todd, there's probably some edits, and it may just be that specific code. And I could have swore he said Z codes in general, but
No,
we
there
made
are
it-
some
we
Z
made it-
codes. It's not all Z codes.
Oh.
But I don't know what his coding logic is on that. I mean, he'll have to look at that. But this is a good
But I bet
example
you-
just to show him. I mean, we need to fix the issue, but we'll show him the problem.
Okay.
Yeah.
So we're gonna tell everyone to
was
start with this
Z48.
code. That's what we're gonna do. And who cares?
That's
if
what I
we-
would suggest for right now. Is find a different code to start with, so we know we get a date.
Yeah, we want them to drop it.
Yeah, so we're just gonna tell everyone this one for now, because it comes up with the date and it works, and that's what we're gonna do.
Right.
Okay,
I10.
and then just when I know you guys are over time, so
You know,
I don't know when's the right time to talk about the
wait,
tables.
Let me find it. I'll just find another code that is like this, but one
Okay.
that we would probably
Never
never use
Oh, okay,
or hardly ever use.
okay.
Like,
About the tables and the goals, do you have a chance to look at that right now, Brendan, or do we need to reschedule a different time for that?
No, I've got a couple minutes. We'll see. At least just tell me what the issue is, and we'll kind
Okay.
of see what we need to do.
So Leslie, can you tell them your one?
Oh, okay, pull up,
Care needs called.
well, yeah, so it's when
You want me
you
to-
explained it, the care needs.
Yes.
You want a
So when-
patient?
Yeah, so go to.
You need is this on the patient level?
Yeah,
Let's
let's,
the patient level, that's right. Because it looks correct in the
Okay.
tables, but then when I try and do it with a patient, I can't get it.
go to.
Okay, let me see.
I can give you a specific, patient to look
Okay.
at. The last
Okay.
name is, Morrison, Morison. One R. It's a different spelling. Thank
Am
you.
I
And it's-
spelling it wrong?
One R.
There you go.
Okay, and
Which
that one,
one?
Princess, top one. Top. And go to, care needs
Okay.
and click on edit goals. No, edit goal descriptions. So pick up the top one. And it just goes nowhere. It doesn't open it up or allow us to edit it. Pick the next one down, pain.
I think I can already tell you the problem. Let me double check myself
Oh, great.
first.
Okay, awesome.
So Brendan, first I thought it was too many characters, but then I have some that are shorter and it brings me to the box and it's in black and I put in 4 visits, like I add 4 visits, then I hit save, but the 4 visits doesn't stick. It just stays whatever was in orange.
So the issue with what's going on this patient, I mean, there could be other issues with the other patients. Once any of those care needs get pulled into a service note, it's going to lock it down. You're not going to be able to edit those descriptions anymore. You're not going to be able to remove them. You can only end date them. And so that's what happened here, is that they got pulled into this service note. If we delete this service note, that you will be able to make those changes again.
I appreciate what you're saying, Brendan, but I'm doing these just on, so we did the start, no visits are done yet. I'm just creating the care needs for the clinician to use, and this is when the problem arises. So I see what you're saying now, and I understand that logic, that once it's applied into a visit, you can't change it. But it's happening at the very start when we're trying to create it onto the 485.
Yeah, you can pick another one that I created. Which one do we use here, knee or hip?
Well, part of me thought if you
Well,
did
I'm
it.
gonna
Okay, go ahead.
I'm gonna show you real quick. When you add these and these are not attached to a service note, it's gonna be completely different. So this, I'm gonna just add this CVA.
Okay, good.
Yeah, that's
Save.
one of ours that we made.
And so now I'm gonna add my interventions. And just, this is the only one in here.
It's
And then I'm
goals
gonna
that
add-
it's happening on. Yeah, we're not
Yeah,
having it.
we'll do a couple of these
Yeah.
goals.
Perfect.
And there may be another issue. I think I just saw it just then. It's those asterisks. So now I'm going to choose edit goal description. Oh,
Yeah.
It's going to let me do it.
Yeah, see,
Well,
let
we
me
did. I
do
was
this.
going to say we did edit around the special characters now.
Yeah.
I mean, but there's still some
Yeah,
special
that's right.
characters. Be very careful with special characters. I mean, we have tried to allow for everything, but nurses can be and therapists can be so creative with some of their special characters that they've combined together that it actually implicates other programming languages. So be very careful using special characters. Try not to get too in depth with that. Like I said, we've tried to allow for as many as possible, but as many as we try to fix, we still find some field staff that can come up with some pretty creative special characters that the system is reading them as programming language, and it creates a problem.
So you're saying the problem was the asterisks?
No, the
Could
asterisks
be.
are one. I thought we had fixed that. No, the asterisks actually work.
can-
But I'm just stating in general. Please be careful with special characters.
Here,
Okay, so I don't
And
have
it
to go
works.
back and.
This
redo
one
those.
works.
zoom into here.
Yeah,
This
Yeah,
one
the
works.
fine.
I mean, I went in there and made those changes, and I hit save. And the reason I was able to is because these are not in a service note now. Now, once, I'm telling you, that one service note you had was your problem. That one service note right here, if we delete it, this routine visit or this PTA routine, if we deleted that opened up all of this back up, so it's not going to be locked down to anything.
With us, it's through Zoom.
Well, let's try that. Can we do that, Brendan? I mean, because this is just a test patient, right?
Do you guys care if I delete this note?
Go ahead, I'll tell her. Yeah. It just, on the,
You want me to create a Zoom?
it's working for you guys. You're not seeing well, we did edit out of the gate before a service now. All right, I'll have to tell Lorraine.
Yeah, tell them I'm I'm sending it from this computer,
Okay.
and then they'll be able to enter.
See, now it's able to edit that.
No, that's a
It's
short
this one
one.
here. And it might be
That
because
still-
of the pound.
And I'm wondering
It
if
might
there's
be because
the asterisk and the bracket, or the pound sign and the parenthesis.
So too many special characters?
Yeah, and I'm not a developer,
What's on
but
the
there's
bottom one?
sometimes when you put parentheses with special characters, it means something in computer language. I don't know what it means because I'm not a computer, but those kind of things they have really been our worst nightmare with this. I just say try and be very careful. I know it's hard not to do it because I do it myself, but it just throws problems into the system.
So only one special character per line item?
No, I can't even say that. It's just like I said. Actually, what I saw there with that parenthesis and the pound sign, a lot of times that does mean something. So, like, that's where the issue was on that one, because it was a parenthesis, an open and closed parenthesis with a pound sign in the middle means something, and that's where I think, and I'm guessing, but I just know that they're like trying to find a needle in a haystack.
So we'll just,
How do we need to do it correctly, I guess, and we'll go in and fix them up so that they work. That's just all I really needed to know. I didn't need mine to be right. I just need to know how to do it right. Because I already entered like 10 of them. Some work, some don't. So I wasn't able to figure it out.
so it's the multiple.
I'm betting without really going through them all. I'm just, and I don't know what else, like even just use parentheses with spaces or try that when you're using parentheses not to put special characters inside a parenthesis is what I would suggest.
Well, we'll just, or we'll just avoid
Yeah.
parentheses. We can do it another way. We'll just,
Yeah.
But we can, as long as we know. we can use
Lodash has
the
always worked
asterisks.
good besides asterisks. Lodash
What's
seem to
that?
good. Now asterisks by themselves seem to be working.
Yeah, asterisks,
but yeah.
because I know we programmed around asterisks, but not, like I said, I don't know about everything else. I know we've tried them as we find them.
Brendan, what was your other suggestion besides asterisks?
Those Lodashes, or I mean, the asterisks by
The
themselves
underscore.
are fine, but the underscore, I guess I'd call it Lodash, but the underscore is the
A good
ones
one,
I
yeah.
would do. If you want them to fill in a blank, just do the
Like-
underscore and make it look like a blank, and it's easy for them to understand too, out in the field. But be careful. I mean, it seems like the parentheses are the worst part, and then the
Okay, that's helpful.
it's Carefficient. It's a web browser, based system, so it reads HTML code, and those special characters show up as HTML code, and it messes with everything, and it does cause problems. So just be careful with those. Lodashes or underscores are best.
Okay,
Okay, I had originally put like ... and then I put the pound sign to mean number of visits. So maybe the number sign was the problem.
Well,
So-
and also I would know ... is one, because again, when you look at a lot of code, there's a lot of times they have like 3 dots afterwards. So ... I know are one of the, that's another one that can. So like I said, I really wish I knew all of them, but just from different experience, ... and stuff inside of parentheses are definitely problems.
All right, so we'll just use underscore and hopefully it will work. So I'll go in and change all the ones.
Correct.
And we'll see. Okay, thanks
That's
so much
what we
for your
do
help.
from base. Yeah, we just throw in these underscores. We don't do any other special characters, and you won't have any
Okay.
issues.
That's good to know. Thank you so much.
Absolutely.
All right. Anything else?
I think that's it for right now.
Okay.
Thank you.
thank you.
Okay, all right.
All right.
welcome.
Thank you. All right. Bye.
All right, you guys have a great one. Bye.
Bye.